So, cosmetic surgery is traditionally considered enhancing what is normal. Reconstructive surgery really is considered repairing what has been damaged, and things can be damaged in the face. You can be born with damage to the face. You can have an accident or trauma, and that can lead to disfigurement and scarring, which can be repaired. Sometimes infection can also cause damage to the face, leaving defects. And then other tumors, skin cancers and things like that. And that would involve removal of an area of tissue of the face, and then the reconstruction is really putting that tissue back together. And mostly we utilize skin on the cheek because there's plenty of skin on the cheek that we can utilize in a reconstruction. When we are talking about reconstruction, we really do need to think about other methods that we can use. And a lot of people think that plastic surgery is about inserting bits of plastic into the face. And actually, plastic surgery comes from the name plastikos in Greek, which means to mold and shape. So plastikos means to mold or shape tissues rather than actually inserting bits of plastic, which a lot of people think is the function of a plastic surgeon. Really, we do use fillers and other things that may be confused with plastic injectable fillers, for instance, or even your own fat can be used to transfer and bulk up the tissue. So reconstructive surgery really is about repairing what has been damaged by, as I say, tumor, trauma, infection, or something you've been born with. And cosmetic surgery is really about taking what you've got, even though you may not like what you've got, in terms of a loose neck or hooding of the eyelids or blemishes, deep pores on the face, but really taking what is normal and enhancing it to get to a level that you'd like to be at with your face. And again, the aging process on the face should be considered in 3 zones. You can have the upper face aging with the brow descent, upper lid skin becoming excessive, the mid face, really the lower lids becoming baggy or puffy, and then the lower face, really jowl formation, loose neck. Other things that we deal with in cosmetic terms would be prominent ears for correction. And again, a lot of children will get teasing, and adults as well will get teasing of when they're at school or in the workplace. It can cause quite significant psychological damage. Another common operation, although I don't do this myself, is rhinoplasty. Again, rhinoplasty surgery is often considered in people that don't like the shape of their nose, and obviously the nose is the most prominent part of your body visually, and so it's a common reason that people come and see us for surgery. Okay, so patient preparation for surgery, obviously in trauma surgery or reconstructive surgery, the patient may not have any chance to prepare, say, the infection or the accident happens. So there's not really preparation for reconstructive surgery because often the patient is involved in, tumor removal or the accident as described. However, for cosmetic surgery, there's definitely some things that patients can do to enhance their healing power. And various techniques have been talked about over the years. We have low-level laser therapy to improve circulation. Radio frequency can also be used to sort of prime the tissues and get the tissues ready for sort of surgery. However, in most circumstances, facial surgery doesn't really need any preparation because the skin has such a powerful healing ability. So it's not really something that I do too much to prepare my patients for surgery. Occasionally we do use retin A if we're going to do a chemical peel or something like that to just get the skin nice and ready for the actual insult that's about to occur with a chemical peel, which is basically a superficial burn that then recreates collagen in the face and allows it to look better. But in most instances, I don't really ask patients to prepare for surgery. If they have cold sores or a tendency towards cold sores and we're doing significant surgery on the face, then I'll often prescribe acyclovir in those cases, but there are a few other instances that I would specifically prepare the patient. Acne and things like that, it's good to get acne completely under control, I guess, before doing any significant surgery so that there's a low risk of infection. But generally speaking, most patients are ready to go as soon as they come to clinic because they're looking after their faces and there's no sort of pathology that would worry me. However, in the last year or so, I have been using K-laser, which is low-level laser therapy, and it really primes the tissue with blood supply and may speed up the healing in some sort of facelifts and other such surgery. So what is involved in both types of procedure in cosmetic and reconstructive surgery? Well, essentially surgery is surgery. It doesn't matter whether it's cosmetic or reconstructive. So what the surgeons are doing in these procedures is essentially lifting skin. And as we said, plasticos means to mold or shape, doesn't mean necessarily plastic. So, and then we mold and shape depending on our requirements of what we're trying to achieve. So in reconstruction, often we're trying to fill a defect or untether a scar. And essentially it's the same thing. We make an incision, we lift up the tissue, and then we suture the tissue in the direction that we want it to be. So in reconstructive surgery and cosmetic surgery, essentially it's the same surgery. We are delicately handling the tissues, and that's the important thing, and that's something that plastic surgeons are really, really good at, is that we've been trained for years and years and years to lift up tissue, handle tissue very, very delicately. And just in picking up tissue with forceps or, tweezers, you might call them, you can damage the tissue, and damaged tissue can lead to bacterial infection because a small area of damaged tissue can lead for the bugs to sit on that damaged tissue, and then an infection can get hold. So the main skill of the plastic surgeon is really to handle that tissue as delicately as possible, not stitch it too tightly, because again, overly tightly stitched tissue can lead to necrosis. So essentially the surgeries are the same. It's the tissue handling that's the essential thing. That's the skill of the plastic surgeon in this sort of facial surgery. So how long does it take to recover after reconstructive or cosmetic surgery? Well, essentially, I guess we should look at this in phases. The skin on the face has an amazing blood supply and an amazing ability to regenerate and repair. Most skin healing is within a week or two on the face. Even if you have a defect and you just dress this, say following a tumor excision, that skin will be healed within 1 to 2 weeks. Even if there was a defect, a couple of centimeters in size, again, the skin closes over and regenerates very, very quickly, which is great for anyone that does any facial surgery, because it makes us look good, because the patients are actually healing for us. So if we were doing facelift surgery, for instance, we'd make an incision in front of the ear, behind the ear. We'd lift the skin up in front of the ear and redrape the skin and tighten the structures, suture the skin, and literally within 1 to 2 days, that skin has sealed itself, become totally waterproof, so the patients can shower after the surgery. And within a week to 2 weeks, it's strong and tough enough to actually just go about your daily life. Now, in some instances, I've now been using something called Artise, which is a fibrin tissue glue. So when we're lifting up a layer of the face, we need to stick it back down, because if we don't stick it back down, then you can get hematoma forming in the space, and that hematoma can delay the healing. So the tissue glues that we now use, they allow us to stick the skin down to the underlying muscle so that no bruising or hematoma can occur. So that's been something that's really improved my facial surgery. And now I don't really put in drains in surgery at all. And literally the patient can go home the same day, because there's very, very little chance that the tissue is going to cause trouble. And also in using the glues, we take less tension off the suture line, so that the pressure that was actually held by the sutures, and again can cause tissue damage, has been alleviated by using the tissue glues. So most things in the face are healed by 1 to 2 weeks, and people are really surprised by that. You know, we say, oh, you can go back to work next week and there won't be really much bruising. They just can't believe that that's the case. But so things heal pretty quickly in the face, and it's very forgiving, and we utilize that, and it makes us look good in facial surgery. So the commonest facial procedures that I do, I mean, I guess we should look at this in the zones. So the face is normally divided into 3 zones. So the upper zone, the mid zone, and the lower zone. In the upper zone, the commonest thing we do is brow lift and upper lid blepharoplasty. And often we can do those in combination. So your upper lid skin becomes hooded because your brow drops. So a blepharoplasty is often combined with a direct brow lift or an endoscopic brow lift. In the mid face, it's the lower lid, that's the common problem. And again, baggy lids, lids with loose skin, wrinkles around the eyes. And in the mid face, it's really hollowing of the mid face and descent of the mid face so that you look gaunt and skeletalized. And really, facelift will restore some of that volume in the mid face, but we can often augment that with fat transfers. We can take some fat from your neck and inject it into the cheekbones to give your cheekbones a nice high looking natural and youthful appearance. With the lower lid, we often take the eye bag and we'll re-drape the eye bag so that it's not bulging, and then we just tighten up the skin by hitching the skin to the corner of the eye. We have to be very careful doing eyelid surgery so that the eyelid doesn't get pulled down. In the lower face, really, it's facelift is the commonest procedure, and this improves the angle of the mandible, and often people that have a turkey neck or a loose neck will improve that situation as well. So facelift is a very versatile procedure. It's probably one of the commonest procedures I do now. I don't do anything weird and wonderful. I do something called the classic facelift, which is essentially lifting up the skin, tightening the muscles underneath the cheekbones, above the nerve layer, and then we might augment that with some fat transfer to just try and improve the tissue qualities. Now, some people do deep plane facelifts, which is, in my opinion, it's not really worth the risk, because the risks of nerve damage from doing more aggressive facial surgery is not really outweighed by the benefits in the deeper plane facelifts, in my opinion. So I like to keep things really, really safe, because if someone comes in for a cosmetic surgery operation, they do not want complications. They want to leave without bruising, and they're coming in to improve their facial appearance, not have a complication. So it's about safety for me. Safety, safety, safety. On the ears, again, prominent ears, that's probably one of the commonest operations that I perform, often in children before they get to sort of teenage years, when they're starting to get teased at school. And as I say, I don't really do much in the way of noses or rhinoplasty. So that's the surgical side of things. On the non-surgical side, there are other things that we do, such as chemical peels to resurface the skin and improve the quality of the skin, and the common things like Botox and fillers. I'm not a huge fan of recurrent use of fillers, because I think with long-term and recurrent usage you can get problems. So I would use fillers as a temporary measure, and then if patients like the result, then I use micro fat transfer. That's the sort of way my practice has been evolving. I don't do much in the way of laser resurfacing, but I do run a clinic where we've got people that are interested in laser resurfacing, which is useful for blemishes, spider nevi, and certain such skin issues. So I've been asked what I'm proud about in surgery, or something that I think is unique to me. I mean, I've been told that often it's my ability to communicate with patients and put patients at ease, allow them to discuss their issues fully. I'm not really into just focusing on one part of the patient and just treating that in isolation. I try to look at people holistically, if at all possible. And sometimes we have patients that come in and, you know, they're coming in for a certain procedure, but they've got other things going on with their diet. They're not sleeping well. Their nutrition, you know, it's not optimum. They're not exercising enough, and all these things. You know, beauty and, you know, well-being is not, it doesn't just come from uh, the appearance of something. It comes from how you feel about yourself, and really how your body is functioning, and is your body functioning at optimum. And so a lot of patients get the chat from me about their sleep, about their diet, about whether they're exercising enough, whether they're stretching enough, whether they're doing mindfulness and meditation. And all these things really do help patients get through surgery. And actually, most general practitioners these days, they haven't got time to talk about these things. Whereas in a consultation, you know, I can spend up to an hour with the patient, and, you know, once I've talked to them about the facial surgery, we've still got lots of time left to talk about other things. So I'd say that was my my USP, is that I'm really focused on whole patient sort of health and well-being.